How else did pharmaceutical companies focus on women to increase sales of their drugs?
The so the pharmaceutical companies had marketed. They had an experiment that was done at Walter Reed Hospital at taxpayer expense in the 50s called the executive monkey experiments, and they took two monkeys. They strapped them into a machinery, and they were only able to move their arms, and they would deliver electric shock to each of the monkeys. Then they put a lever next to one of the monkeys, and if that monkey operated the lever, it would stop the shock to both of them. Monkeys are pretty smart, learn to operate that lever pretty quickly. They did this experiment hundreds of times. They would do autopsies of the monkeys after each time, and they found out that the monkey who operated the lever, the so-called executive monkey, the one that had to make the decision, had arterial cirrhosis, had ulcers, had all types of problems with the organs and aging of the body inside. The non-executive monkey, the one that didn't have to operate the lever, didn't have those issues. So pharmaceutical company took those to be women and men. So that therefore the men who had to operate the lever, they were the ones who had to look strong for society, go out in the 1960s and be breadwinners. They were the ones who needed drugs in order to operate better, be able to bring the money home and never show that they were under any stress. Women who weren't operating the lever, their main problem was they were never going to come down with ulcers, but you needed them just so that they would be able to work better. What does this mean? Ritalin, which is a stimulant, was advertising to women in the 1960s, showing them with a vacuum cleaner, doing more vacuuming faster. Valium was running ads where they showed a 35-year-old girl who had not found, a 35-year-old woman who had not found a husband, and said 35 single and neurotic, and explained why she needed Valium to make her feel better about her life. And all of the images that were sold to doctors as scientific information about men was that those very same drugs would make them stronger in going out and being able to do what they had to do in terms of society. Pharma marketed hormone replacement to women for beauty, for the vanity of look better and you'll be safer with this drug. So even in those instances, they played to what I view as the sexist marketing, which worked always to the disadvantage of women. The marketing to women of pharmaceuticals in the 1960s and 1970s is one of the most distressing parts of the American drug industry, in my view. Doesn't mean there's not subtle, subconscious marketing that takes place today, but it was overt then, and it worked in many cases.
How big is the medical industry, and what percent of the United States economy do they make up?
So it's almost impossible to just take a slice and say, okay, here's how much of the U.S. economy or the gross domestic product is medical industry, because it's not just pharmaceuticals, which are big, $1 trillion, but it's also medical devices, thousands of medical devices. It's the number of visits through doctors. It's imaging labs that do all the MRIs and the X-rays that are done. It's the hospices that provide care for cancer care and others that are part of that long extended thing. There are hospitals and clinics. So if you put it all together, it's a significant portion of the U.S. economy and a growing one as well. So that what I find is, you look at it here, we pay more in the United States, not only for prescriptions, we use more prescriptions than anybody else, we pay more per prescription, but we also pay more for medical care, and we aren't necessarily healthier. Pharmaceutical companies like to say, oh, in the US, people they have a lower incidence of heart disease, they die of a lower incidence of heart disease and cancer compared to their European counterparts in England, France, and Germany, because they use more drugs. There's no evidence that that's the actual reason why, but the difference is very, very small. All I know is that compared to the European countries, we use a much higher percentage of drugs, and we aren't necessarily any healthier for it.
Are you done writing about pharma, or do you think you'll write about it again?
I've always said in the past, 13 books and none of the books are related. So the book before this was about a history of finances in the Vatican. I've done books on political assassinations and done books on Nazi war criminals and 9/11. So normally, whatever I've written about last, the next book, I don't know what it is usually not about the last subject, but I am still tied to pharma in some ways. I'm still working on it. I just did that editorial about Janet Woodcock and why I don't think she should be the FDA commissioner. I did 3 editorials last year in the New York Times since the publication, 2 of them about the Sackler family in Purdue and how they might get away with billions of dollars in profits from OxyContin, 1 about how the drug companies themselves were roadblocks and obstacles to the development of a vaccine on COVID. So, and another one in Newsweek, I wrote about how some of the companies who have been developing so-called treatments for COVID use the rumors of those treatments to make millions of dollars for the executives by selling stock at inflated prices once the rumors hit. So there's plenty to do in the world of pharma. I don't know if my next book will be on it, but it's a tougher one for me to break away from, because we all have a moment at which we go to a doctor and there's some condition or something's come up and they want to prescribe something to us. And then we have to decide whether we want to take it or not take it. It's what I call the pill syndrome. It comes into our lives if you live long enough. And as a result, this topic affects all of our lives in a way that some of the other subjects I've done did not.
You mentioned antibiotics and antibiotic resistance. Are we on the verge of completely losing antibiotics due to antibiotic resistance? And is that situation getting worse?
No question, antibiotic resistance is a major problem. As a matter of fact, the first chapter in my book is called Patient Zero, and that's a woman who was hospitalized in 2016 in Reno, Nevada, with what should have been a bacterial infection that should have been cured by antibiotics. And they gave her every antibiotic they had in that hospital, and nothing worked. And then they alerted the CDC, who sent them every antibiotic they had, 15 antibiotics, given everything that was known in the US. None of them worked. She's the first patient to die in the US of an antibiotic resistant strain that nothing at all worked on. And that is what doctors are afraid of. The second to last chapter in the book is called The Coming Pandemic. I don't mention in the book the word COVID because COVID had not broken out by the time I finished writing this. What I was talking about in The Coming Pandemic is what doctors say will be a bacterial-based pandemic because of antibiotic resistance. Since the 1950s, when antibiotics came out, doctors have been overprescribing them. If antibiotics are a good thing, I believe that penicillin was a good development. The idea became in the American medical community, well, if it's a good thing, then let's give more of a good thing out. And they prescribed it for everything. They gave it out for things it should never have been prescribed for. Many of the conditions for which they prescribed them, from the sniffles to a sore throat to wherever, were minor viruses that people would have naturally recovered from. Instead, they gave them antibiotics when they didn't need them, and people started to develop resistance to it. They've done that over time. Couple that with the fact that in 1980, there were 36 companies in the United States developing or researching antibiotics. Today, there are none. And that's because they've all left the field of antibiotic research. It's all abroad now, basically in China and India, because there's not enough money in it. They've looked for more profitable drugs in chronic diseases that people have to take pills every day. So we have a combination of fewer companies doing new antibiotic research, with antibiotic resistance growing because it's used in the food supply and in agriculture. And as a result, there will come the moment at which human nature teaches us a lesson. It will finally come up with a pathogen, a superbug that already kills tens of thousands of people a year, a bacteria that is immune to all the antibiotics on the planet. And at that point, we'll be scrambling for something to be able to fight this pathogen from spreading from one person to another. It's not here now. I don't mean that to sound like gloom and doom. Nobody during the middle of COVID needs to hear somebody say, oh, you think COVID's bad, wait for the bacterial pathogen antibiotic plague. I'm just saying that we have put ourselves into a situation as humans, in part because of the fault of the drug companies, to create a drug that we've become largely resistant to because we've overused it in so many different areas. And now we're complaining about the fact that that resistance is out there, but none of the drug companies are doing anything to try to come up with a drug that might fight it because there's not enough money in it. That's madness.